Sorry, oh. Hmm. You guys. So, because I'm going to be staring at screens, I have to use my glasses. If not, I'll have eye pain. So, forgive me if you can see these two lights reflecting. I'm so sorry. I am so sorry. Hello, hello, hello. It's nice to see you guys. Don't even know. Okay, let me try without the glasses. Maybe subsequently I'll now put it on. So hi everybody. Live chat. I'm so excited. I'm a bit scared though, but pretty much excited. Mostly excited compared to scared. So that we don't have a boring wait, I had asked people on Instagram or WhatsApp to ask me some medical questions. That way I can start, and then when people join they can ask their questions. So at any time that you join the stream, please you can drop your questions in the chat box. Okay, so one of the questions that I had gotten, oh my, one of the questions that I had gotten was how many times should a woman do CS? But there were some CS questions. How many times should a woman do CS before she would say, "Oh, I shouldn't take in again"? So the truth is that there's no direct answer to that question. There's no number. That's the truth. There's no "oh, it's 4" or "oh, it's 5." But the more you do the CS, the more your likelihood of having complications. So the commonest complication that people have from CS is uterine rupture. Now, because there's a scar on the uterus, normally if you have a wound, it heals the scar. But the truth is that the scar tissue is not as strong as the normal tissue. So because there's a scar there, every time the woman gets pregnant, of course, the uterus gets bigger. That's the it's bigger, and then she's at a higher risk of having the uterus rupture, that is open up where that scar is. So normally the higher you go, the more it is. So typically after your fourth, your fifth, depending on other risk factors that you might have, your obstetrician will likely advise you not to go again. And this is also the reason why after two cesarean sections, a woman should not try for vaginal birth again. Because hi. Okay, because if you try for vaginal birth and the uterus is contracting, remember that what we call labor is the uterus contracting. Those are muscles contracting. So that contraction predisposes the woman to an increased risk of having this uterine rupture. So there's no number, but the higher you go, the more your chances of having complications. So another CS question, since we don't have questions yet on the chat room, another CS question that is commonly asked is how long should you wait before you take in again if you have a cesarean section? Um, okay. Before you do, how long should you wait after a cesarean section before you take in again? So how long should you wait? At least 2 years. That's the straight answer. But the longer you wait, the better. Again, this is because of what I've explained before, so that the tissues get to heal before you take in again. So obstetricians will typically say two kin. I think I lost network for a while. I tell people should not try me on this stream. Okay. So while we wait for other people to join in, I just want to say thank you for your support so far. I was when we hit 1,000 subscribers, I was not really what's the word? I was not posting videos actively, so I didn't celebrate that. So maybe this should be a celebration for that. So I want to say thank you so much for supporting me, for being there, for watching the videos, for checking up on me when I take my breaks. I know. But hopefully we'll not have those kind of breaks again. Hopefully, I hope to be very, very consistent this season. So ask the chat box, please, so that I can answer them. There's music playing in the background, but I cannot hear because of the noise blocking mic. Okay, while we keep waiting for people to join, another question that I had gotten, I want to do a surgery and I'm scared. What should I do? So my answer to that question is everything in medicine is risk benefits, right? Is risk benefits. What is the risk involved? What is the benefit? So if the surgery is something that is going to benefit you, outweigh the risk. Certified place, of course, in a hospital that is experienced, should be somebody that knows what they are doing, and of course, in a safe environment. So, what once all of that is handled, I believe that you should have your surgery safely, without any problems. It's the same thing with even medications. When we give medications in medicine, it's okay. My network is still on. All right, so it's the same thing when we give medications in medicine. You always weigh the risk to the benefits. What is this medication going to benefit this person compared to the risk that the medication is going to pose the person? So it's the same thing with the surgery. I know it's difficult, even even as a doctor. I've never had a surgery before, but I imagine that I would be scared as well. So yeah, it can be scary, but you should go ahead and do it if you actually need it. But make sure it's in a safe place where you're sure that the surgeon knows what they are doing. That's what I have to say about that. Hi, Nena. Hi. Hi. Thank you for joining the stream. Thank you. Well, it's so far so good. We're waiting for people to join in. That's how it's going. We'll have a few people on the live stream. Well, it's our first live, so yeah, this is an opportunity to sort out all the kinks and all of that. So I'm waiting for people to join. That's how it's going. But I've answered some questions so far. That was why I collated questions in the first place, to avoid awkward process as much as possible. Let me drink water while we wait. So, water ambassador, drink water, drink lots of water this year. Energy drinks. Energy drinks are not very good for you. Oh. Well, everything in moderation. Energy drinks contain a lot of caffeine. And if you're someone that is not used to taking caffeine and you take a lot of energy drinks, well done, no. But caffeine has some side effects. It alters your sleep and all of that, and you can even increase your risk of having hypertension. So it's best not to depend on energy drinks for anything. It's actually not very good for you. But if you have to take energy drinks, take it in moderation. That's my answer to that. Okay. Energy drinks. I don't take energy drinks, so I'm not a fan of caffeine. I don't take energy drinks. Oh my god. Please, if you're on the stream, you can help me share the link so that other people can join and we'll have a robust discussion. I'm really looking forward to that. Okay. You have a lot of reading to do, and then YouTube is also takes a lot. I mean, a lot of people don't appreciate the energy that goes into filming, editing, especially if you're a one-man team like me. Like if you're the one doing everything for yourself, planning, scripting, all of that. But what I do is that I plan my content. I don't just release content anyhow. By the beginning of a month, like this is February 1st, I already know what I want to do for February. Of course, if something comes up that I want to talk about, I can easily just make a video about it. Then I also batch film my content, right? So if I sit down to make a video, I make multiple videos. I don't just make one video. Then you having me in word round with it. Yes, so well, after I did the malaria typhoid video, I think we had a patient that was suspecting typhoid enteritis. So someone was like, hey, sure you are the one making shey anyone making videos on malaria typhoid ngwanu, what do you think about this thing? So yeah, sometimes they use it to yab you, but usually it's in a friendly way. It's not in a derogatory way like that. It's usually friendly banter, sha. And then sometimes when people recognize me, I'm like, are you not that doctor that used to be on YouTube? I'm like, yes, it's me. That one I feel weird about it when it happens because I don't know. Am I really ready for this whole what YouTube entails? I don't know, but when people recognize me, I've had a medical student stop me. Oh man, I watch your YouTube videos. And I'm like, oh, I felt so shy, but yeah, it's nice. But it's not usually it's friendly banter. Usually, it's not so bad like that. Okay, this life thing is so different from like sitting down and having a planned video because having a planned video is continuous talking, you know what you want to say, but this one you kind of have to wait for people to join in and ask you questions for. It's a different dynamic, definitely, but it's interesting. Yeah, it is. Okay. Is there a point in my YouTube journey that I'll consider quitting medicine? Omo. Nena. Okay. If I'm being honest, because honesty is the best policy, right? I've thought about quitting medicine, especially when work gets very busy. But the truth is that I really like my specialty. I really like rheumatology. So even if I don't have like a government job, I would probably have somewhere that I would see patients and I'll be volunteering. But because I'm recently rediscovering my love for medicine, he still works. If, even though his channel is very big. So yeah, I don't think I'll. But maybe if YouTube can become the main hustle, why medicine becomes the side hustle, I guess. So yeah, but let's see how it goes. But I don't think so. I don't think so. I would want to be practicing, you know, I want to in some form, even if it's volunteering, but I would still want to do practice in some form. Yeah. Maybe it could change. It could change, oh. It could change if things are, yeah. Yeah, it could change, but for now I think I still have some love for medicine. Yeah, it does happen. Sometimes you're really you're just tired of medicine, but then something happens, you're like, ah, this is not, not too bad. Or maybe, I remember this experience that I had when she was talking. She was those kind of moments make you want to continue the job, but sometimes it can be one kind, and you want to think about other alternatives. In fact, I even thought about being a gas wife, so just sitting at home and being a full-time housewife. That's not to say that being a full-time housewife is not work, because during my leave, I wanted to run away from my children. So that in itself is a lot of work. But yeah, I've considered Oga's wife too. And even the whole everything, just being at home. But I don't think I'll be able to do that, Sha. Hmm, hmm, I think I can relax. Well, I had to sit on my bed because of network. So this place I'm sitting is not very comfortable. I think I should take this out. Oh, this is too low. Sorry, oh, this is too low. I couldn't use my makeshift YouTube office because of network. Network there is bad. So yeah, I tried MTN, I tried Airtel, it wasn't really working out. So I just had to be here. But I think so far it's still fine. Mm. So you're talking about Niger? Well, me and Niger, eh? Hey, me and Niger, I don't know. Let's not talk about Niger today because Kai, it's well, oh, this Niger matter. No, the end. Yeah, this is the awkward pause I wanted to avoid. I did not want awkward pauses. Ask me question, oh, if you're around. Well, I think the next life I'll have a guest on so that like we can be talking awkward pauses like this. What do you want me to tell you? It's true now. It's true. The doctors have money. They don't now. Ha. Please, if you have money, give me. Oh. Doctors don't have any money in this country. They don't have any money. Oh my god, that's funny. Mm. Ask your questions. I'm here for you. Ask your questions. Hmm. Eh, my jaw is aching from laughter. If you join, say hi so that I can see you. Hi, Pamela. Omo, this question strong, oh. If I'm invited to where I don't know. I really don't know because the best. Okay, so I don't know what I'll say to pupils on a career deal, but I would probably just give them the benefits of what I think are the benefits of being a doctor in Nigeria. Um, but still let them know like the downsides to it. That way they make an informed decision. But then again, it's depending on the level of the pupils. That way, I'm sure of what I'm saying. Maybe 2 years ago, 3 years ago, I'll probably tell people, if I had known when I was in secondary school, I'll maybe not be a doctor. But then I've come to the realization that I actually like being a doctor. So yeah, that has changed. So I'll probably not actively discourage people from doing medicine the way I thought I was going to before. Yeah, it's good to be a doctor. Just know, well, tell them the benefits of being a doctor. You get to save lives. I probably recommend gifted hands to them because it's gifted hands that got all of us here. So yeah, maybe recommend gifted hands. I think Benkasi did a very good job of making people want to be doctors there. Even though when you now come to medical school, you realize that more neurosurgery is not my calling at all. Well, some people still go ahead to be neurosurgeons, so that's fine. Yeah, but I'll just encourage them to it's a beautiful thing to be a doctor. Um, it's a career path that you could enjoy, and yeah, I don't know. I'll probably have to prepare more to be able to do that. Yeah. Then what is the best place to practice rheumatology in Nigeria? Well, I'm only in Jos, so I cannot say what happens in every other place. Yeah, but I think everything is available no matter where you are because we're a closely knit society. So you are pretty much in touch with a lot of the other centers, so you're able to know what is happening. We get to meet very frequently, so if there are any new updates, if there are drugs you need to get, you can always arrange it. So it doesn't really matter where you are, you will still be able to practice fine in Nigeria. Most of the things that are available elsewhere you'll still be able to get no matter where you are. So yeah, I don't think there's a particularly best place per se, but yeah, that's what I have to say about that. Wish you guys could hear the music in my background, but copyright. Cannot put music on this life. Oh. Ah, so I'm just realizing that I'm not good at talking off the script like that. Yeah, well, practice makes perfect. If you look at my first video on YouTube, I was not as good at talking to the camera as I think I am. Yeah. Maybe as I practice, I'll get better at this. Yeah, as the channel grows, I'm sure that yeah, it's my first life. If we had more people, more questions, it would make it easier. But it's fine. It's my first life, like you said. Yeah. I think I'll give it a few more minutes and then I'll call it a day. How is the cold in your area? Hmm. If you join, say hi. Let me know that you're here. How is the cold in your area? Since people don't want to ask me question, let me ask you. Hi, Chidera. Hi. Do you have any medical questions for me? What is this state of doing? Hell, I hope I'll be able to edit this thing. If not, I might not be able to live it life. Um, Thank you. Is there still heat where you are? In this Jos, there's still a lot of cold. A whole lot. In fact, it's very cold. Chidera, go ahead and ask your question. Okay, you said how safe is ondansetron in pregnancy to handle nausea and vomiting? Um, okay, well, it's a well for nausea and vomiting in pregnancy. We usually start. I'm not an obstetrician. Disclaimer. So, but for nausea and vomiting, we usually start with placil, which is metoclopramide. Yeah, I hope you know what that means. That's where we usually start for pregnant women. Then, if it's really, really bad, I know we use promethazine. If I'm being honest, I've not used ondansetron before for a pregnant woman. Maybe the obstetrician will be better suited to answer that question. But I've not used it for a pregnant woman before. But I know that placid is safe, promethazine is safe, especially if a woman is vomiting a lot. Morning sickness is normal in first trimester. Some people up to second trimester they still have morning sickness. I had a lot of morning sickness when I did my first pregnancy. But then when it gets to a point where you're not able to function, you're vomiting, you can't eat, then you would have to take medications. And I know we use promethazine, we use metoclopramide. On that citron, I'm not too sure. Let me not say what I am not sure of. So I'm not too sure about that. It's probably something I would have to check up. Mm-hmm. Because typically in pregnancy, especially the first trimester, there's a lot of developments going on for the baby, so you have to be very careful with drugs. So yeah, but I know if you're not pregnant, ondansetron is great for vomiting. In fact, that's what we use in cancer patients. But for pregnancy, Kai, I'm not sure. Okay, 12 degrees in Jos. Yeah, it's really, really cold. If you want to experience abroad in Nigeria, head on over to Jos. It's cold. Chidera, what do you think about my answer? Who else is on here? Say hi. Let me know that you're here. Someone talked about Nena talked about Niger before. How is Niger treating you? Tell me in the comment section. Because I don't have comments, but I stay positive. I stay positive. I stay positive. Nena, you said Ah, you said Okay now. My dear, that is the answer to the question, really. People are being honest. Hmm. Hmm. I mean, I don't go on Twitter again. No, I don't. As in, I try for my mental health. I try to avoid Twitter as much as possible. Like I just stay on Instagram. A lot of the news of Nigeria, I don't visit news websites as yet. Just since I stay off all those things, all the news about Nigeria that I get is on WhatsApp status or people's status because like every time you go on Twitter, it's one bad news or the other. It's a beg. I just had to take a break as well. Then we're together. Oh, just had to take a break as well. I don't. The only thing that sends me to Twitter is maybe if someone posts something and it's something I'm interested in reading, maybe on a group or on their status, then I just go and read it and quickly bounce out. Because, I mean, I've never really understood Twitter. I think I was actively using Twitter before the ban. And after the ban, I just didn't get actively using in quotes. So because what was I even tweeting? I just didn't know how to tweet. I think I don't even I just used to maybe tweet people's stuff, repost, things like that. But not to talk about now that everywhere there's just so much beg beg. It's true. There's just so many can become anxious from Twitter. There's already so much happening every day. Not to talk about joining Twitter tweets. If you're on the live, are you on Twitter? What's your favorite social media platform right now? Let me know. Instagram. Okay, that's mine. I have to YouTube. And recently, I've been liking TikTok. Oh, I was afraid of TikTok for the longest time. Yeah, Instagram has good vibes. Everybody's so cute. Everybody's living their best life on Instagram. I'm telling you, good vibes upon good vibes. Well, I'm recently liking TikTok, even though I realize that if I go on TikTok, I spend a lot of time. So I try as much as possible to limit my use of it. I used to be afraid of it for the longest time because I just didn't understand it. But then I decided to also grow my brand on TikTok. So I started using it and it's not bad. It's not bad. Even though I think most times I watch movie clips, it's a way for me to find new movies to watch. Just they usually show you all those clips. So if I watch a little bit of the clips, I say, okay, maybe this is an interesting movie to watch. So, what movie are you watching currently that you are really liking? And not say Skinny Girl on Transit. Well, watching that one. Which other one? Okay, maybe I should start with me. For me, I'm watching The Rookie now. What is the color purple? I don't know that one. Maybe I'll check it out. But I'm watching The Rookie now, and it's nice. I think I just started watching it anyway, and it has like 5 seasons. So I'm just wondering what have I done to myself. And I think I'm still in episode 2 or 3 of season 1. But these days, Seth, I think the way I realize I'm getting older is that I can no longer binge watch movies the way I used to before. I think it's a good thing, but then again, it's also a sign of It's a sign of aging that I'm getting older. So now, if I'm watching movie, I can sleep off while watching movie. That's something that my mom used to do, and my dad. I'm telling you, oh, old age, as in, it's not small old age. Ha! Before, all through the night, but now, small thing, I don't sleep. Huh, it's well, oh. But I think it's good for me, oh. It's good for my mental health. I think it's good for my mental. Screen time is not the best for any human being. So yeah. But then again, I cannot say I reduce my screen time because I'm still on Instagram, on TikTok, on YouTube. So have I really reduced my screen time? Oh, but it's something we should all strive to do. Okay, so I think at this juncture, I think once it's 6:45, I should end the stream. If I think this was not bad. This was a good. I had a good time. So Nena, thank you for joining, and every other person that joined, thank you for joining. I am grateful. Thank you for your support so far. I am grateful. Yeah, bye. Thank you so much. Love you guys. The next probably would have a guest, maybe a specialist, and then choose a particular topic. I think that will make it easier. But I like that we did something new and we're trying something new and we had a good time while doing it. So yeah, thank you so much. Bye everybody. Bye. Who just joined? Say hi. Let me say hi before I go. Sorry, you joined late. What is that emoji? I don't know what it is. 'Cause I don't have my glasses on. Anyway, bye guys. Thank you for joining the live. If you're catching this after the stream, why didn't you join? But yeah, you probably join the next one. Okay. Bye everyone. Bye. See you some other time live.